Well, 3.2 million Aussies are living with chronic pain, and it can, of course, be debilitating. The most common complaints include migraines, arthritis, cramps and back or abdominal pain. 70% of those who go to the GP and end up on medication giving a short-term fix but creating long-term dependency. And 44% of sufferers end up with depression and anxiety. But what if there was a way to get natural relief through your diet? Is it possible, as some foods have natural pain-killing powers? Clinical nutritionist Sarah Lorenzo joins us now. Sarah,
good morning.
Welcome back into studio.
Thank you.
1 in 5 Aussies over 45, that's quite a figure, are living with chronic pain. How severe is the problem, and I guess what's the reality of the danger when it comes to long-term dependency on medication for this kind of treatment?
Okay, so the problem is actually severe because it's on the rise. Just like you mentioned, there's currently 3.2 million Aussies living with chronic pain. In 2050, there's going to be 5.2 million. Yes, there's lots of reasons for chronic pain, but what we're seeing is an increase in lifespan, but not necessarily an increase in health span. So it's chronic disease reaching things like chronic pain, and then chronic pain obviously causing people to go to the GP and look for lots of over-the-counter pharmaceutical medications, which we know in the long term with use and abuse will lead to things like damage to the kidneys and also toxicity to the liver.
Right, so you've pinpointed some good foods with regards to the benefits for anti-inflammatory issues.
Yes. Okay, so what we're looking at here is basically salmon. So salmon's known for its anti-inflammatory properties and is fantastic for people for their joints, so it can work well with arthritis. I would be suggesting that every other day. Blueberries as well, studies show are fantastic for rheumatoid arthritis, a cup a day. Olive oil. So olive oil has a compound in it called oleocanthal, which actually acts like ibuprofen, so a tablespoon a day for medicinal reasons. And then for turmeric. So turmeric has to be, honestly, it's quite
offensive, turmeric, isn't it?
There is so many studies to support turmeric as it works like ibuprofen. I would be suggesting, and studies show, a tablespoon of turmeric a day into your diet, and ginger. Ginger is like just a universal anti-inflammatory, everything from, it covers everything, and I would be recommending probably a tablespoon a day of fresh ginger into your diet for pain relief.
And what about foods for common pains, things like headaches, back or abdominal pain, even migraines? Okay,
so just things like for back pain, first of all, it's the resveratrol. We'll find it in red wine, but it's only 1 glass a day for ladies and 2 for men. Mint's fantastic for abdominal pain, also for sufferers of IBS. So getting mint into your diet with teas or oils. Chili is actually a pain blocker, so it actually tricks the brain into releasing endorphins, so it actually blocks pain. And for migraines and headaches, looking at something like pepitas or the pumpkin seeds, having a good handful of those a day, they're rich in magnesium, so they're really going to help people, and just incorporating these into your diet.
And you've got a Sarah Lorenzo special for us on Podium 3. What's going on down there?
Okay, so what I've done is a lot of my patients will say to me, my pain patients will say, how do I get more turmeric and ginger into my diet? Because they're hard things to incorporate. So what I've made is a turmeric latte. Now, whilst it looks really posh, it's actually not. It's so easy to do. It is basically that it's got some turmeric and ginger with some milk on the stove. I put some cinnamon in there as well. And another thing I've created, and in particular and especially for pain, is a muffin. But I've got loads of turmeric, loads of fresh ginger in there. I've got some pepitas on top. It's made with oats, so it's a great way to start your day. And just making these little twists and tweaks for people who are suffering from a lot of pain, they can actually start looking at shifting these into their diet and then possibly making the switch long term.
Looks excellent. We'll put the recipes up on the website. I might have a little sample too, if you don't mind, while we throw them on.
They're so good.
I'm often in pain working with Monza.
Oh, save me one. I need some too.
They are good.
Are they good?
Yes.
That is a good muffin.
I know.
Sarah never disappoints.
A creation of mine.
All right. Thank you both so much.